As a physician, it's shocking what I've learned about infertility and what's going on in the United States. Why don't you tell us a little bit about that, Meg?
Seeing more and more people walk through the door, frankly, that are frustrated, many of whom they've gone to a fertility clinic and center. They've perhaps exhausted their savings, perhaps their family savings, with the hope and promise that something will change, the approach to conceiving and delivering a viable fetus to delivery, having a wonderful baby in their arms 9 months later, is getting to be frustrating for men, not just the women, but the men as well, who they're getting to listen to their wives complain, maybe,
Are they
remorseful,
concerned?
concerned, absolutely.
Yeah.
They're just as frustrated. And they keep saying, why is this happening? Great question. We wonder whether or not the focus of hormone levels, and we know men's hormone levels are changing and plummeting over the decades. Are we seeing examples of that with women? Yes, but the reasons why are actually pretty fascinating. We talk often about inflammation. The ability to conceive and deliver and carry to term. Inflammation is a big part of this as well. It's not just about how your gut is performing or if your brain's on fire or if your joints ache, but now whether or not you can release eggs, whether or not those eggs will be delivered to the uterus, whether or not the uterus is in a hospitable or inhospitable environment for that, whether or not, frankly, that ovum becomes the target of your own immune system. So when we talk about autoimmune disorders and diseases and inflammation, the idea that you are allergic or immune to your own eggs, the ability to implant, is becoming a hotter and hotter topic.
That's interesting. Can you go into that a little bit?
Yeah, autoimmune. So the thought is, okay, if we have so much inflammation, it appears to be of an autoimmune nature, is this in fact the culprit? So if you've got eggs, you're 25 years of age or 30 years of age, you have follicles, you have eggs available, and you can get those eggs into the uterus, but something happens. You have what we call a medical pregnancy where you start to release HCG, and it would, by all accounts, appear that you're pregnant, and yet you cannot implant that ovum. What's happening? The thought is either the uterus and the lining is inhospitable, or our own body is attacking that egg, destroying it before it has a chance, which is pretty scary. So what do you do about that? If you approach this from an autoimmune inflammation perspective, you've got to start by looking at self. What are the things that cause inflammation? You and I both know, we see folks every single day. Their brain's on fire. They've got poor gut health.
Because inflammation is systemic. So
Exactly.
You can see it in other areas.
Exactly. And it is foolish to think that if it's systemic in your head and your gut and your joints and everywhere else, but it's not in your uterus, that's kind of a fallacy, isn't it? So I tell gals 4 to 6 months before you anticipate trying to get pregnant, you've got to look at your weight. Are you 20, 30, 40 pounds overweight? That's the first place you've got to start, because you and I both know if you're overweight, your insulin sensitivity is compromised, and that's the first degree of inflammation right there. So start with your weight and look at that through a very serious lens. And look, we're not shaming you, and we're not saying, oh, you should be happy in your skin or you should be ashamed of the weight you're in. It's just a fact that when you carry more weight around, everything is inflamed as a result of that, including the uterus. So why not look there? The next thing is, what kind of exercise are you doing? We know that women who are trying to conceive should not be doing extensive exercise that's bodybuilding in nature. I tell folks all the time, I want you to think about being a swimmer and not a Spartan. I want you to have lean, toned muscle mass. But if you start going to the gym to develop a lot of muscle mass, what ends up happening is you start to dysregulate your hormones and your cycles. Pretty soon you have no cycles, because now you're very lean, you look amazing in a swimsuit, but this is not the right environment for an ovum.
Pregnancy.
That's the first thing I tell folks is you've got to watch the weight. You've got to be mindful of the amount of exercise that you're getting, which tends to be contrary, frankly, to many who approach this. Get out, exercise, stay fit, be as fit as you possibly can. No, not really.
So
30 minutes of exercise 3 to 4 times a week is the max you should be doing. Working with weights? Absolutely. But you don't want to be the Spartan. You want to be toned and fit and ready, but If you're losing your menstrual cycles because you are so fit and no fat on you, that's contrary to what you would want to hope happen.
In those cases, are we using more expansive or longer term hormonal testing to say get an idea or perception of what their cycles are doing through the month?
And you have to, because again, that frustration can linger. 28-day mapping cycle through Dutch is a great way to look at a woman who still has cycles, but they maybe are starting to become irregular. Frankly, they've tried for a year to conceive and are failing to do that. Then you have to look at whether or not your progesterone peaks too soon. Is the cycle that you're preparing for fertilization too short? So those windows of opportunity can be viewed using that Dutch mapping test. I find that to be incredibly value add, especially in that situation. Look, it's not for women that are in menopause and beyond. There's no need to map a cycle that you don't have. This is absolutely for women that are trying to conceive, frustrated that they cannot and don't know where to start.
And then seeing the men, I've also noticed that there's, with good reason, emphasis on starting to optimize men's health as well. We have seen a number of younger men with lower testosterone levels, which is critical. It's easy enough for us to test not only the endpoints of the production of sperm and the levels of testosterone, but start to dive a little bit deeper into why these may be problematic if they are. So we have to ensure that we do that. And I think one of the things that we frequently overlook for both men and women is the role of inflammation that is secondary to infections. We all know about the adverse consequences of venereal diseases, gonococcal, syphilis, to name a couple, but there's some lesser known diseases that are becoming more and more prevalent and were frankly not thought of as problematic not too long ago. And luckily now through gene-based testing, we can look for those more rare organisms. Men are frequently asymptomatic, but in women we know cause the inflammation that can disrupt the ability to implant a fertilized egg. A couple of those are ureaplasma and another was called mycoplasma.
That's right.
Very small organisms that, unless you're testing specifically for, frequently go missed on standardized testing. And I'm glad we offer those tests here.
Absolutely, because frankly, to miss and not offer that nowadays, you're missing an opportunity to really change the story for many women. So I'm glad that we offer this. It's easy enough to do. It's not painful at all to perform this test. And the results can yield a lot of information and certainly help to get you to a better place as far as having that knowledge and ability to move forward with your desired pregnancy.
Frequently because they're asymptomatic.
That's right.
They don't even know. You don't even know if you have them.
They don't even know.
And so now with a simple urine test, we use this one here. The test is non-invasive. It's non-painful. The results are very quick. Since they are based on genetic material, I think they're very reliable. At least you give a starting point. So we're not saying that every fertility problem has an easily identifiable cause and that we can treat successfully every potential patient, but just know that once the more standardized approach to infertility has been exhausted, we here at Longevity Lab in Las Vegas have a unique set of labs and protocols that we can, one, diagnose and potentially help in the treatment of this disorder, which is so debilitating to families and is unnecessarily ignored, potentially. So
once we've kind of figured out what we need to do, whether it's changing weight, changing exercise, changing sleep patterns, pulling things out of your exposure, epigenetics, we call those, pesticides, herbicides, phthalates, colored foods. Once we pull those things out, everything from head to toe, I go through with women, from the shampoo that you're using, to the toothpaste that you're using, to the tampons that you're using, to the body lotions and creams. These all have an impact on the body.
I'd like to, if I could, just circle back on one thing that you've done some extensive work on, and that is spike proteins related to COVID infections. Because I know that the Europeans at one point were thinking about suing to stop the administration of the COVID vaccine because of a concern of the overlap of the spike protein with proteins that we currently have and ensure normal attachment of the placenta to the uterus. And That was never really explored, but I know it's becoming increasingly a matter of concern.
And there are a few labs. The one that we use is LabCorp. They offer a very elegant test that allows us to look at the amount of circulating antibodies related to spike protein COVID. It's easy enough to perform the test. It's very valuable information in my book. So the number you're looking for is 1,000 or below. For anyone that has a number higher than that, it could suggest either long COVID, based on symptoms, frankly, or it could be an explanation for chronic infertility. And frankly, you can't ignore this anymore. It's very much out there in population now.
I agree.
And you would really be leaving something on the table that you could have explored, should have explored, but did not. So we do it absolutely here at this clinic to make sure we're not missing anything, leave no stone unturned. Because again, infertility treatments and the emotional cost and the financial cost is significant. These kinds of things, whether it's infections that are not detected or antibodies that are in elevated numbers, or poor optimization of a woman's health prior to embarking on this journey, all these are fixable things. These are very manageable things. Should leave you once again with a sense of hope and optimism that it can be addressed.
You find elevated antibodies. Is there something you can do about that? Good. All right.
Absolutely. There is a spike protein detox protocol. I've modified mine a little bit. I think all of us that are in the functional medicine space like to tweak things a little, but there are some pretty standard things. The nattokinase of bromelain is a perfect example of that standard of care. I throw a few more things in there that helps the body to adjust to what we're about to do to it, which is try to clean these spike protein antibodies up, decrease that circulating number,
Perfect.
and optimize the ability for conception.
So what I find exciting about the advancement of medicine, particularly in the last couple of years, is some of the research that has been done on optimizing the egg itself.
Mm-hmm.
And one of the fields that I think is showing a lot of promise is the use of IV NAD. Its effect on eggs that may have some genetic abnormalities, because one of the functions of in the human is to correct DNA damage. So this is another area I think that's up and coming, but it's going to show great utility for those.
And we do that here, as you know, IV therapy that includes NAD, certainly glutathione. These are wonderful adjuncts to the treatments that we've just talked about, or the ability, if you will, to optimize that egg health. So we can't necessarily say they're going to stimulate more follicles to be released, but we do want to optimize the health of the potential mother. Give her every opportunity to carry to terms. It's not just a question of conception or even implantation, but of course you have to carry to term as well. These are all ways that we optimize that effect and offer hope for the future.
So why don't you tell them where they can find us?
You can find us at Las Vegas LV Longevity Lab, Las Vegas, Nevada. If you think you have questions, if you think some of these things may be about you, does it feel like we're talking to you, please come talk to us. We would love to talk with you about this. Just recognize there's hope, there's answers, there's all kinds of possibilities ahead for you that you may not have explored. We want to give you that hope and those answers today. Give us a call.